measuring effectively, I look at things from a business perspective now, okay? So if we tighten patients in our practice with radiofrequency, with other technologies, how many of them tell their friends about the technology, come in, give you a credit card, and then just really happy when you're finished with these treatments? And then my answer is going to be very few. We do some, they're okay, happy, but I don't know of any practice, and anybody in our practice that's truly ecstatic about all of the non-tightening things that we've done to them. We do it, it works a little bit, but other than maybe a little thermy on the neck or with the device on some areas of the body for big areas and tightening, I don't think anyone's really happy.
Yeah, I would agree. And I think the other thing that when somebody says, I look at it a little bit differently, as a surgeon, and I don't doubt that you can get some tightening, and we've all seen the occasional patients with Ulthera, Thermage. I mean, there's an occasional patient where you'll see some tightening by photography, but if you do a facelift and you pull them so tight that there's not any other skin you can get out, just follow them over 10 or 15 years, and that skin will eventually loosen over time. So if we're doing so much less than that, the question is how long does it last when it's very subtle? And so I look at it differently. I think that we talk about even with CO2 laser and erbium laser, you can get some tightening. But if somebody weighs 400 pounds or 100 pounds, and if you let them stay stable for a while, that skin's going to settle to 32 millimeters of mercury. That's just where it likes to live. So I don't think these, even if you get a little, to me, I don't think it lasts very long. So I look at lasers as rejuvenating the skin and the quality of the skin, but I don't use lasers to really tighten skin a lot.
Dr. Burns had an important concept there in that you can surgically tighten skin, but I think you want to throw another word in here, and that's really the composition of the skin, or if you biopsied and look the amount of collagen, the amount of elastin. Surgery pulls old skin, but it's still old skin. Devices can change the nature of the skin to make it thicker, tighter, younger.
Probably the greatest problem with skin aging is elastic tissue loss and the loss of elasticity. That accounts for a lot of what we see as far as aging, the failure of the skin to snap back, a loss of stiffness. And even devices where it's been shown unequivocally that you restore elastic tissue. There was one great study with the radiofrequency needle device from several years ago, I think the E-Prime, by Hantosh and colleagues, 2 great articles showing unequivocal restoration of elastic tissue. The clinical results did not accompany the biochemical results. So there's a disconnect sometimes, even when we see some restored elasticity than what we see clinically. So it's very complicated. And objective measures like elastometers, these external devices that work on stress and strain relationships, they're compromised as well. So it's very challenging, and we're far away from where we need to be.